So today's tutorial of the day will be the cubital fossa. So this is the triangle in your arm. So if I put my arm here, so we're thinking of this kind of area here as a triangle. Okay. So to start with, I draw a triangle and a second triangle. So this is going to be lateral and this is medial. And then this small triangle represents the biceps brachii tendon. Here is the brachioradialis muscle. Here's the pronator teres muscle. And here's the biceps brachii muscle. So the first step after that, so step 2, is we add in the arteries. So when you're trying to cannulate an artery in the arm, then what you can do is you can bend your arm, feel the tendon. And then if you just feel, put your finger medial, straighten your arm, and you'll feel your pulse. That is your brachial artery. So draw that straight down here, represented by this line. So that's your brachial artery. That then divides into your radial artery and your ulnar artery. The ulnar artery passes down the medial side of the forearm. I just draw that, as you'll see in a moment when we add the nerves. That's useful. So next step, we add in the nerves. So on the lateral side of the tendon, you'll have the radial nerve. And this gives a branch to the posterior interosseous nerve. And this supplies some of the bones. And that's kind of important because if we're blocking the radial nerve at some point, then if we block it too low, we could miss the branch. And obviously everyone's slightly different and their branches will come off at slightly different levels. So next we add in the veins. So I do this as like a diagonal H shape across the cubital fossa. Now the way I remember how to label them is I put my arm out with my thumb pointing upwards, and then this is the lower side, which is medial. So that's the base of the arm. So that's the basilic vein. And then this is the medial side, which is nearer your head. So that is your cephalic vein. And then this one's your median cubital vein.